much. Hey, man, we're working on it.
Yes, it did.
Okay.
It's good stuff. Well, I want to thank you for the kind introduction, I think. You know, I've got to tell you, as you can tell if you look at me, I've ate a little bacon in my day. But you never know what the hell staff is going to come up with is really the bottom line. Look, it is an honor to be here to visit with the American Legion today. I want to thank you all for your service to this nation. I want to thank you all for traveling to Washington, D.C. and being a voice for nearly 2 million, for over 2 million veterans across the globe. I especially want to thank the Montana Legionnaires that are here today, Roger Hagan and Merv Gunderson and Kelly Ackerman and Bill White. You guys raise your hand. Where are you guys at? I hope you're here. You here? Oh, damn it, they left. Oh, it's the way it goes. They've heard me speak before. It's good. And we're also very proud of Diane Carlson Evans, who just won the Patriot Award. She is an incredible asset to our great state, and I think incredible asset to this organization, and very, very deserving of the Patriot Award. I want to thank you for what you do here at home and for our country and for American veterans everywhere. I also want to thank a fellow that you guys, I'm sure, know, a guy by the name of Johnny Isaacson, who is a tireless advocate for veterans. He's a statesman, he's a senator, and he's a dear friend of mine. I've been proud to work with Johnny to get 8 bills to President Trump's desk and signed into law. And to be quite honest with you, I think Congress could learn a lot from the way Chairman Isaacson operates, putting party politics aside and doing what's best for our country. But our work is not done, and we'll get to that work that we have yet to do here in a moment. First, I want to start by addressing recent reports of Secretary Shulkin's travel last summer. The Secretary made a big mistake, and he has taken some steps to do right by the American taxpayer that he serves, and I expect him to comply with all the recommendations that the Inspector General has laid out in the Inspector General's report. As ranking member, I visited with Secretary Shulkin. I told him that I would be holding his feet to the fire to make sure that this kind of behavior never happens again. And why? Well, for a number of reasons, not the least of which is that we have pressing and urgent issues concerning veterans' health care before us. We cannot afford to let these efforts get derailed or jeopardized by the actions of him or any other unelected political appointee that are sent there to do a job to serve our veterans. And that is why the reports of internal feuding over the future of the VA are so very concerning to me. Let me be clear. Standing alongside the American Legion and millions of veterans across this country, I will always fight at every attempt to privatize the VA. I do not support starving the VA from financial or human resources. I do not support diverting critical funds that make it more difficult for the VA to meet the immediate and long-term needs of veterans, whether we're talking about resources needed to maintain VA facilities or resources to recruit and retain talented medical professionals. And I do not support efforts to use struggling facilities as a justification to close them. Privatization and privatizing the VA will be more costly to the taxpayers. Doing it will slowly strip away from the resources and benefits available to veterans until only a skeleton of a healthcare structure remains and becomes just another insurance program. Special interests, political appointees in key positions are doing their best, some of them, to put the VA on this dangerous path, sending a dramatic increase of veterans into the private system that isn't equipped to handle such an influx and doesn't offer specialized veteran-specific care is not what America's veterans deserve. And it is not what you have earned through your service. It is, in fact, a recipe for disaster. In the words of Legion Commander Denise Rowan, and I quote, "We believe the VA is a system worth savings." I couldn't agree more. To those special interests that want to put the VA on a path to privatization, I have just one message. You're going to have to get past me and past the hundreds of veterans in this room before you're able to do that. For once, it is time that they take their cues from the veterans and not their financial or political benefactors. As I look around the room, I couldn't be prouder to be a partner with you. Together, we've accomplished a lot over the past year. We've gotten 8 bipartisan reform bills signed into law. The American Legion has been instrumental in getting these bills across the finish line. In some cases, these laws are a direct result of your hard work. President Trump signed our bills to streamline the disability appeals program. The VA is now piloting a new system that lets veterans choose the best path for them to appeal their disability ratings. It wouldn't have been possible without years of work by you. The President has also signed our bill to get rid of the 15-year window for the veterans to use the GI education benefits. Now, this bill strengthens GI benefits to make sure that the veterans and their beneficiaries are getting the best education and job training possible. Again, this would not have been possible without your advocacy for the Forever GI Bill, which was aptly named after Legionary Harry Colmery. And of course, President Trump signed our bills to remove bad VA employees, to protect whistleblowers, and to cut red tape for veterans seeking care and to better deliver VA benefits. Now, we must hold the VA accountable to implement these laws properly. We have given them the tools they have asked for. Now they must use them in a manner that Congress and the American Legion has intended. And we'll be making sure that they do exactly that. 2017 was a big year for veterans legislation, but we can't let the plow get rusty. The choice program needs to be replaced. Veterans are frustrated, and so are the doctors. That's why we must work together to pass a bill that Chairman Isaacson and I negotiated called the Caring for Our Veterans Act. This bill is the best shot we have at a bipartisan, thoughtful, positive community care reform program. And it will protect the VA from special interests that want to privatize it. And the American Legion, once again, has been instrumental in providing input on this legislation. Our work together on this bill has spanned months, and it has involved veterans, VSOs, the VA, and the White House. Together, we have crafted a bill that will scrap the 7 VA community care programs and replace them with one single, integrated, streamlined system with one set of rules for veterans, providers, and the VA. Our bill creates an easy-to-use healthcare system that puts the veterans at the center of the medical decisions. Our bill will make responsible investments in VA doctors and nurses and mental health professionals. It will break down barriers for veterans to receive mental telehealth care closer to home. And it will expand the VA caregiver support service to veterans of all eras. Now, this bill passed the Senate Veterans Affairs Committee by 14-1. It has the support of 26 veteran service organizations. It is past time for the administration to endorse this bill so that we can move it forward and get it to President Trump's desk for his signature. But reforming community care isn't the only item on my to-do list. We have to bolster VA infrastructure to make sure that every VA facility has the equipment, the manpower, the resources to take care of veterans in a safe, private, and clean environment. In some cases, we need to bring facilities in the 21st century and help them stay on the cutting edge of medical technology. We can't expect the very best health care in cramped exam rooms and crumbling buildings. And that is why, as member of the Appropriations Committee, I'm going to be fighting for increased investment in VA facilities in the upcoming appropriations process. But we all know that a brand new building doesn't do much good if there aren't well-trained medical professionals that staff it. We can start by incentivizing medical students recent graduates, and physicians who work in the private sector to come to the VA. Medical professionals want to care for our veterans. It is incredibly rewarding work. We just need to give them more reasons to choose the VA and need fewer headlines that encourage them to look elsewhere in the private sector for work. And that is why I have introduced several bills that will reduce and address the VA workforce shortages. The Bipartisan Better Workforce for Veterans Act cuts the red tape so the VA can hire doctors and nurses quicker in a more timely basis. It also formalizes the VA initiatives to bring medical students, recent graduates, and former federal employees who worked in the private sector to the VA. And I recently introduced the Stronger Medical Workforce in Veterans Act to help bring much-needed resources to rural and underserved facilities, critically important in my state of Montana and I think rural states throughout this country. This bill identifies underserved facilities and creates a pilot program to test our retention initiatives, like providing full student loan reimbursement for medical professionals to work in these rural medical facilities. The care and the benefits that we extend to our veterans are just as much a mark of this strength of our country as the military has in their aircraft, their weapons, and their troops that protect us around the world. The VA is critically important when it comes to recruitment, the next generation of folks who are going to protect us in our military. Over the last year, we have given the VA ample resources to serve America's veterans, and we've given it resources to improve VA facilities across the country. But we've given them the resources also to hire doctors and nurses and psychologists to care for the veterans in hard-to-reach areas. Now, the VA must use those tools and those resources to make sure that we're serving the veterans in every corner of this country. I'm going to keep holding the VA accountable to get that job done, and the American Legion can provide critical insight to how the VA is doing. If it's using the tools appropriately, or if it's not using them all, I need to know. If they have the tools and they're working, we need to know that. If they need additional tools, I need to know that. Honoring the men and women who serve to us is not a partisan issue. It is not on the Senate Veterans Affairs Committee. It is a bipartisan responsibility. That's why we've been able to do some great work on the committee. And quite frankly, when it comes to serving our veterans, it is one of the costs of war. So with your help, I am confident that we can do right by our veterans. You communicate with me, I'll make sure that your word is heard in committee and on the floor of the Senate. I want to thank you all for being here today. God bless you all, and God bless America. Thank you. Thank you. Thank you. Come over here. Just a little bit. All right.
Thank you, Senator Tester. Thank you for all you do for those who have worn the fabric. Please be seated. For the fabric of our military. They have served, and now you serve them. And thank you once again. And our legislative director wants to make you a presentation. You ought to hear these two when they get in the office up there by themselves. I had the privilege of finding out a lot more about both of these in November.
I would quickly like to point out that the cutting board is in the shape of the state of Montana.
You did say about the gift prize.
Yes.
Okay.
Pretty damn good bacon. It's honey smoked.
Introduce me next.
All right, so I'm going to give you. Thank you once again, Senator. We really do appreciate what you do.